Ladies and gentlemen, welcome to your next riveting session at Perspectives: A Time for Change. I'm Dan Gemp. I'm the CEO of Dreamscape Marketing. And while I wish I could be with you all in person, we'll keep this social distancing going. Today we'll be presenting from Dreamscape's empty headquarters in Columbia, Maryland. So check out the office and none of the people behind me. And great to be with you today. So without further ado, the topic we'll be discussing is addiction treatment marketing must shift rapidly. There have been massive shifts in how consumers are searching for treatment, especially on digital marketing, and where you need to be to engage your patients while they're in that search process. So who am I to present on this topic? As I said, I'm Dan Gemp. I own Dreamscape Marketing. We work with treatment centers and private practices in 39 states. We have launched over 600 websites in behavioral health and addiction treatment. And we've run over 400 treatment center digital marketing campaigns over the last 15 years. So a lot of what I'll be presenting today is from our actual campaign data, some before and after comparisons, and what we're seeing with actual admissions trends, right, through your own websites and the best way to engage your prospects, as well as general trends and how the American marketplace has shifted pre and post COVID. So we're going to boil down into tactics, what you can actually do, how you can best support your community, what I believe you're obligated to do, and some general trends on what has changed the demand. Different types of substances on the rise, a lot of first-time diagnoses. So we'll really get into it today, but it is data-backed from the experiences my agency has had in the space. Let's begin with some general points of concern. Okay, so let's define the market and then shift over to the marketing. With overdose stats trending worse than COVID-19, okay, we need to do a few things. We need to shift the message. We need to look at our audience in a different way. This is very much an epidemic. We're looking at an all-time high, number of overdose deaths this year. Suicides are extremely high right now. And it doesn't look like it's going to be getting better. So demand for treatment is here, but the marketplace is shifting. So look beyond today's headlines. Don't just look at COVID-19 as our problem, okay? This problem of addiction is going to remain long after COVID-19, and it's taking on new forms and it's shifting audiences. So recognize that this epidemic within the pandemic, it's shaking things up. It's changing addiction treatment, and it's changing addiction treatment marketing. So you have to send a different message to a different place physically to get to your audience now. And everything has gone remote and digital and telehealth, and it's changing. I'm going to tell you how to navigate that. We need to be discussing how to more effectively communicate with these patients, okay? People are in need, people are socially isolated, and so without those human interactions, fewer and fewer loved ones and family members are able to intervene at the right time. With this socially distanced world, you may not understand what rock bottom looks like when you get there because it's not really impacting other people as much because you're not interacting with other people. So a lot of the indicators and triggers and things that would let someone know it is really time for you to get some treatment or you may die or end up in prison. These consequences aren't necessarily resonating the same way they were before society-wide lockdowns. It's not even in the news though, okay? The suicide deaths by firearm among the female population is one of the most alarming statistics I've seen in a decade, and no one's talking about it. It's not in the news. The pandemic is dominating headlines, but what it's doing for our space and for your patients is it is obscuring the underlying tragedy. 42% increase in opioid overdoses in May of 2020 compared to May of 2019, a record year. So we're not talking about small single-digit increases, and we're not talking about people in need of treatment. We're talking about overdoses. So this is the end game. This is the acute, life or death struggle. And you throw in some societal unrest and social isolation. We have an explosive recipe here. This is going to be beyond tragic. And so you are obligated to reach out and communicate and get to this audience right now. People know that, Pandemic hospitalization and death tolls are off the charts. They know that 200,000 people so far in 2020 have died of COVID and COVID related complications, but they're not paying attention to what's going to land somewhere between 60 and 100,000 deaths from overdose this year. Okay. From over 70,000 last year. So yes, COVID-19 is a primary and real concern, but using words like pandemic when we are in the midst of an epidemic already, it's comparable. And so, these never-ending articles about safety advice and masks and possible vaccines and article after article and all of this perspective being lent from through a COVID lens, it's really showing that there's little to no awareness of addiction and overdose rates and where things are trending. So I'm going to show you where the market is trending, and I'm going to show you where your patients are, and you need to reach them. The pandemic and addiction, is this a perfect partnership? And I mean that in the darkest sense. Despite shortages of consumer goods, okay, where everybody's short on toilet paper and paper towels and such, and Clorox wipes, but there is no shortage of these easily available items. Beer sales are up over 55% year to date. Wine sales are up 66% year to date. Liquor sales are up 75% year to date. So you want to talk about something that was at an epidemic level a year ago. We're talking about increases of 50 to 100% in the sale of the vices that are a symptom of this disease, okay? So addiction is being enabled in the consumer market in a way that it hasn't been in decades. Quarantines and social distancing, let's talk about how that impacts mental health. Are any of you all the wiser and 10 times happier for being completely isolated socially? So let's look at existing individuals in recovery. Let's look at addiction patients that have gotten through treatment and now they're under quarantine conditions and they're experiencing social distancing and they're isolated. Okay. Are these optimal conditions to sustain a recovery? I think these things are triggers for relapse, and you're going to see recidivism like you haven't seen in possibly ever, right? Loneliness, self-reported loneliness is up over 25%. Emotional distress is up over 300%. So this is first time self-reported diagnosis of anxiety, depression, large-scale emotional distress, divorces, spousal abuse, toxic relationships hitting an absolute peak or worse, actual physical abuse. So pair these things up with the symptoms and signs you're already aware of, and let's throw in another variable, remote work, okay? Yes, it looks like I'm giving this video presentation from the lobby of our office, but our office is empty. I'm in my home office right now, next to my living room. So this remote work, I don't have to drive anywhere today. No one else other than this wonderful audience today is going to see me. And so realize that this remote work enables people in another way. You don't have to drive. Does that mean you can drink? Throw in variables like massive unemployment of tens of millions of Americans and the stress that that creates. Let's say someone is new to their recovery, just got a job, and then got furloughed. What does that do to your mental health and your psyche in general? So essential employees, let's talk about frontline workers, military, nurses, police, EMTs, okay? People receiving suicidal phone calls at 911 helplines. These essential employees are the new at-risk group. So think about this, right? You're seeing unemployment, furlough, all of this. You're a frontline worker and you're seeing 200,000 people die. You're seeing our elderly die. These are problems that have never been seen, and it's going to have a lasting effect on the market. How have states enabled alcohol addiction? This one has been intriguing to me. So certain models of private practice mental health were not deemed essential, okay? But liquor stores have been deemed essential in really every state. So somehow our society requires liquor to function, okay? And is evidenced by sales of said liquor. But dentists weren't essential, to put this to scale. Other healthcare services that you might, deem as important were not, on a state-by-state basis, declared essential. So some governors prioritized alcohol sales, okay? In late April, online sales of alcohol were up nearly 500%. Okay, so online alcohol sales are generally regulated state by state. Delivery services aren't widely available. 500% increase in online liquor sales. That's never been seen before. So there's a new economy now for the distribution of alcohol. And let's talk about the consequences, okay? So alcohol addiction fueled by the pandemic, combined with all the other statistics I just shared, this is going to outlast the pandemic. You don't just go back to work. Things don't just stop. Society isn't exactly back to it, right? So again, I'm laying the groundwork. I'm showing you what's going on because it is a different message that resonates with your potential patients right now. It's not the same pitch that you were making even in January. And the demand is there. We're at an all-time high level of substance abuse in America, if not the world. So let's talk about how stimulating the economy has stimulated stimulant sales. Say that 3 times fast. As the economic stimulus packages kicked in, was that good or bad for people in recovery? Was that good or bad for people with active addictions? So the stimulus kicks in and everybody gets $1,200 in the mail. And if you're on unemployment, you're getting an extra $600 a week. Let's ballpark that at $2,400 a month. I wonder how much an alcohol habit costs. I wonder how much a month's supply of heroin costs. Oh, that's just enough money to sustain these things. Interesting. So it had to kick in. It was necessary to save small businesses, to save the unemployed, to protect families and protect their homes. But the unintended consequence for individuals struggling with an addiction was an ongoing enablement of their vice. Okay, so we have now a case of national enablement. Anyone who needed money for drugs or alcohol got money to be used for drugs or alcohol. And as evidenced again by a 500% increase in online liquor sales. So distribution timelines, this is very interesting. This is something we studied. We saw record admissions to residential treatment programs in our client base in April and May. Pretty good June, but not as good as April and May. And here's what happened. As the distribution of these funds, these bailout funds and unemployment checks hit full speed, you'll see a decline directly in residential levels of care. It doesn't mean people weren't pursuing local care and MAT and outpatient options. Telehealth was also massively on the rise during the same time period. But I'm talking about correlation, not causation. Isn't it interesting that as large sums of money were distributed, that there was also a decrease, even though we know demand is at an all-time high, there was a decrease in actual admissions in that June, July window, and it has come back up since. So now let's talk about COVID-19 and its psychological effects, okay? It's been rough for people that have exceptionally strong mental health. It's been isolating. People are being introspective in different ways. There are normal relationship challenges of just being, quarantined with a loved one, right? Your favorite person in the world might really be getting on your nerves. And this is psychology 101, right? Just the concept of a lockdown and a quarantine and being with the same people all the time. Now let's talk about, actual addiction patients or people that are in recovery. Quarantines and social distancing has been a test of your resolve. This is like nothing anyone has ever experienced. So relapse is going to be a massive, massive problem. There are people who probably relapsed in February, March, and still haven't done anything about it. It's easier for remote workers to sustain abuse of substances while working, okay? Even on video chats, right? If you don't look like you're drunk, if you don't look like you're high, then it's perceived as though you're not. But if you're trying to walk around a workplace and people see you stumbling, that would be a very different scenario. So the pandemic has created an entirely new addiction patient, someone who's been furloughed, that is a happy person with a good family and a good life. And there's just that one change. And now they are depressed and they're just having a drink every night while they send out their resumes. And there are other societal stressors and anxieties that are leading to this dual diagnosis and this co-occurring condition. So most of our clients are reporting a major increase, double-digit increase in first-time diagnosed admissions, primarily alcohol. This is getting interesting to me. The supply chain has also shifted, right? You're not seeing, remember when entire states were locked down, it would not be the same logistics to traffic narcotics around America. Okay. The border would have tens of thousands of fewer cars crossing the border every day. And so the concept of cartel trafficked methamphetamine or cartel trafficked opiates and heroin and fentanyl, the supply quantities changed and the street prices increased for these substances. So we have also seen, as a secondary effect, an increase in primary diagnoses for meth and as well as cocaine. So stimulants are not only back, they're the most rapidly increasing substances being abused. So the quick nature, the abrupt nature of large scale furloughs and unemployment, right? The surprise factor of it, like, but I was at the peak of my career. I didn't know I would be the one on the chopping block. That is a root cause of a lot of these new diagnoses and the toxic nature of lockdown. So you might have been in a relationship that wasn't ideal, or you might not have known how bad it was getting, that concept of being in denial. But this lockdown in particular has seen a ridiculous spike in child abuse, in spousal abuse, in divorces. And so these toxic relationships, the potential fallout from them has been more devastating than it would otherwise have been if you could try to at least physically escape or avoid that environment, however temporary. We're going to shift over here as we finish defining the market. How do you address all of these things in your marketing and your communications and your patient base? So the pandemic's effect on drug addiction, this isn't just gasoline on a fire. This is gasoline on a fire, but it's a giant dumpster fire inside of a plane crashing into a volcano. This is a new kind of market. This is a new kind of patient that you need to be targeting. Supply and demand, as I just alluded to, has been shifting rapidly. With the lack of available heroin, there has been a 32% increase in fentanyl. There's been a 20% increase in meth abuse, 10% in cocaine. That's new. 18% increase in overdoses from these substances. So looking at these things, the market is shifting. Keep this in mind. Now, what's happening on the other side of things? The CDC inadvertently has passed safety guidelines for humanity, right, for the good of us all, that actually expose your patients to a much less controlled environment. So the CDC recommended that health systems delay elective care at the outset of the pandemic. Okay, why would you go to a hospital if you don't have to? But here's an interesting side effect. Here's something that happened, and there's a wonderful article about it at psychcongress.com. The result is that many clinicians continue to prescribe controlled substances without drug testing and are therefore flying blind. Okay, if your patient cannot come in to be monitored on a frequent basis, but they do require those meds, this is now lacking objective evidence to assess their patients for potential drug misuse. So we have a medical community that is caring for their patients to the best of their ability, monitoring them through telehealth ideally, but without those in-person tests, drug testing itself, or employer-based testing, right? The premise of being unemployed means you're not subject to testing in the same capacity. How long can this continue, right? This was meant to be a temporary safety protocol to flatten the curve of COVID hospital level admissions. So given that COVID-19 cases are still increasing, right, and we're entering the winter period here where they'll probably stay at a higher level through the normal flu season, what are the long-term implications going to be for this recommended decrease in monitoring? And I certainly think you're all with me when we know it's not going to be a good thing. And let's throw in some additional stressors, maybe societal-wide stressors, as if things weren't bad enough. In a national survey of everyone, heightened political and social tensions were reported. Okay, so tempers are high, not just temperament, actual anger and temper is high on both sides of the political fence. No matter who wins the elections in November, we're also going to see half of the country being unhappy with results. America has gotten to a place where it's pretty 50-50 on general political views. Do you think there might be some increased substance abuse as people process their emotions pre and post election? So we have not seen societal discomfort at this scale ever. And this is as an industry, right? As a treatment industry. So the big five questions for addiction treatment providers to be asking as we shift into the marketing part of our conversation is, how should our center, how should our practice proceed? What will happen to our admissions? You've probably been experiencing at least new trends in your admissions, some good, some bad. Are we prepared to make the necessary changes? And are we addressing our other audiences? Are you keeping your staff and your patients both safe? I'm also going to lend an interesting perspective on telehealth, right? It has a specific purpose, but it may not be what you think it is, and you may need to shift your use case. Oh, by the way, the competitive landscape, if you haven't been paying attention, right? I read every business publication there is, and I've been watching what our big tech overlords have been working on. But the competitive landscape has shifted too from March until now. So welcome to your new abnormal, where you're competing with ridiculous, projects that you didn't even know were going on. Walmart is adding hundreds of counseling centers to their locations. So you're now in direct competition with Walmart. Google does own a treatment center. The parent company, Alphabet, that owns Google, does own a treatment center in Ohio. So you are directly competing with Google. Amazon just announced in the last week that they will be building out an acquisitions team of healthcare executives to build out a robust healthcare network. National telehealth, okay? There are providers that simply do telehealth that have medical professionals in all 50 states, okay? So your telehealth solution and your staff and the delivery of that is important, but you are competing now at all levels with the concept of telehealth. And there are big national players that provide psych services. We've also seen private equity has been shifting into the market over the last 2 years with an MAT and population health expansion. And so there's new indirect competition that was happening anyway, but the timelines have been expedited for a lot of these projects. Walmart has been busy building out their medical clinics. Google sees a lot of data, a lot of medical data coming in during COVID-19 and related searches for mental health primary and related searches for substance abuse. So keep an eye on this. Everything is changing, not just a little bit. The whole market is. So here's how not to market in a pandemic, and then we'll jump over to what you should be doing to market in a pandemic. Some businesses put their marketing in hibernation mode. You hid and you buried your head in the sand and hoped this would blow over quickly. And that was the wrong move. You need to market your way through a crisis, always. A reduced marketing plan can only equal a diminished patient loyalty base and fewer new patients, right? So as soon as you reduce marketing of any kind, sales outreach, digital, anything, there cannot be an increase in market share. So I'll leave it at that simple concept. If you do less, you will get less. But demand is at an all-time high. There have been changes, relapses occurring at a ridiculous rate, and your alumni need your help. So there's actually new opportunity to be growing and gaining market share. With your alumni and patient outreach, right? Are you doing them a disservice? Are you, by not having your outreach team make their rounds, or if they were on lockdown or working remote, are you doing a disservice to the patients of your referral partners and professional colleagues? Hospitals that need to clear room and make room for COVID patients, they don't necessarily have time to deal with overdose patients or drug-seeking behaviors in the same capacity that they have historically in emergency rooms. You can be that solution. You can be an innovator in these tough times. What is the pandemic's effect on your digital marketing strategy specifically? Well, many people initially put off treatment due to COVID-19 fears. Many programs are now seeing increased demand. We've got clients right now that are experiencing wait lists that have never had wait lists from their digital. And what's been interesting to see about this is, okay, at the start of COVID, if we thought this was going to be a few weeks to, flatten the curve and try to avoid, epidemic levels of plague in our society, right? People use that as an excuse. Well, I'll go next month. Well, I'll go to a few meetings on my own. Well, I'll try a local option, right? But your marketing needs to adapt to a greatly changed landscape. People that are in need of addiction treatment are actually searching for you a different way. you need to address COVID safety head on in your digital marketing. You need videos, you need that banner across the top of your website that says, these are our COVID-19 safety protocols. This is how we're keeping our staff safe. This is how we're still operating during COVID-19. You need to address multiple points to multiple audiences, right? Why is treatment safer than the alternative of not getting treatment? Okay. Why is traveling for treatment still a viable option? Did you know you are 3 times more susceptible to complications from COVID-19 and death if you're abusing drugs and alcohol? So you should really be engaging at a public service announcement media blast level to, really address this issue head on. Have you even had any cases of COVID-19 among your staff and patients, right? You can publish that. You can share that information. So far, we haven't had any issues. In the event that there is a COVID diagnosis, we would do X, Y, and Z. We have quarantine procedures in place. You're safe with us. We have immediate access to enterprise medical services. Think about this too. The biggest change I have seen directly in digital marketing data is there has been substantially less travel for treatment, especially at the residential level, and way more care at the local level, even through telehealth. So what's kind of cool for digital marketing is localized, hyper local, town level, city level digital is actually more cost effective. It should be less costly to shift your digital strategies over to that side of the equation. Talk about a few more trends. If online is now the primary research channel, you're now catering to a captive audience, right? So people are in lockdown, in quarantine conditions, primarily at home. And so they're on desktop devices, they're on a laptop, they're on an iPad, they're on an actual computer. So the remote workforce, which is about 1/3 of the workforce in America, about 35% were in positions where they were able to immediately and on a sustained basis work remote. Okay, so that's about 1/3 of your audience. The remote workforce is more accessible through digital devices right now, much more accessible. There is less ad blocking on home internet networks, less firewall kind of setup than there is on office networks. So your ads are actually reaching more people for the same dollars. You should be cranking up your organic SEO and content marketing strategies, your search engine optimization and content marketing. You should be publishing tons of content right now about mental health, about the epidemic within the pandemic, about your COVID-19 protocols. That's what you need to be doing. It's labor. It's not a costly media endeavor. And paid search, good old fashioned, Google ads, PPC ads, even Bing, they are performing at a very healthy level. The only dip we've seen was that June, July dip, but otherwise your cost per admission should be pretty optimal on that paid search channel right now. What you have to do though is localize your ads. So you're not going to be able to convince everyone to hop on an airplane and fly to Florida, hop on an airplane and fly to South California, Texas. So localize your ads and realize people are seeking treatment. They're not likely to get on an airplane. Oftentimes they've had a change in insurance coverage. So let's say you just lost your job, you're on the COBRA policy, you need to go to treatment before it runs out because you have to be sober to get another job, right? So there's actually pretty immediate decision making and pretty good conversion rates on this digital traffic. And you're able to get to that potential patient where they are, where they're doing their research in their home or a family member's home. Increase your alumni outreach. You will save lives. This is a moral obligation. Consider this wellness checks. You are calling your alumni to make sure that they're alive. And that is not out of business interests. I do not mean this from a marketing perspective. I mean that if you don't do this, you are leaving them on their own. You're leaving them without the support network they need. Meetings have been canceled nationwide. Telehealth meetings are not the same as in-person meetings. The resources are not fully deployed that would counter this. And so your alumni are in need of human connection, and they need to be talking to people who understand recovery. So find time and dedicate staff to just having conversations with your alumni. It will lead to readmissions. It will lead to referrals, but it's going to establish trust, and it's going to let your patients past and present know that you care. And that's going to from a marketing perspective, it'll have secondary effects that do make it financially worth doing. So please call your alumni, text your alumni, be in touch with them right now. It's critical. Deploy telehealth, but I don't mean to simply have it. I don't mean it's a nice to have feature. Telehealth needs to be for specialized purposes. Did you know that many assessments are billable? So you might want to have doctors on the phone doing intake assessments, whether a patient comes to you for varying levels of care or not. That may be a billable service. Uh, do you use your telehealth for aftercare? Can you actually have psych appointments with former patients that came to your treatment center and provide those services through telehealth? Again, it would be billable potentially. So don't view this as a replacement for your normal care, right? Just because telehealth is accessible on a national basis, do not presume that you're so adept at marketing that you're going to outmaneuver these, $100 million funded telehealth groups, right? And you've got 2 doctors available and things like that. So supplement your business model with telehealth and it will be efficient and yield a financial return. But trying to replace all levels of care and just go fully remote, that is not going to work. We have seen groups try. You will meet with a costly failure on the media to patient cost. This is a great time to try alternative media. Okay, so people observing streaming video, streaming audio, services like Netflix, Hulu, Pandora. Everybody's watching Tiger King, right? There's documentaries that have been watched by almost every American during these lockdowns because there's no new content coming out. There aren't that many shows and movies in production. They've all been delayed. So your audience, again, you need to market to them where they are. They're on a laptop, an iPad, a phone, and they're watching these streaming services. Hulu launched a new self-service ad platform during COVID. I thought that was genius on their part. And so you can test this out. You can test out some public service announcement style content, video, commercials, and it's worth the investment. It may or may not be a consistent channel, but right now it's working pretty well. Talk about adjusting for our current normal, and then the next normal, and then the next normal, okay? There's nothing normal about our current market conditions, but because they have changed, it reveals opportunities to good marketers, right? So, okay, the people I'm trying to communicate with are in a different place, shopping in a different way. The challenge is, how do I reach them with a laser targeted approach in that effort? This requires fine tuning. You cannot do the same thing you were doing a year ago and expect the same results, okay? More so than any other event in the industry, things have changed. So for a while, Google Ads was completely blocked for over a year, and it required background checks through a third party called LegitScript to even be allowed to run paid ads on Google's platform again. This is a bigger change than that. So if you thought that impacted the industry, the things I'm sharing with you today, your marketing mix needs to change more dramatically and more drastically than that. Display ads are back, baby. So people are actually on large screen devices again for the first time in a long time. Even though traffic is still primarily mobile, display ads have actually been converting again. Email has been converting again. And both of those were high volume, low conversion channels during COVID. Since March in specific, we've seen those performing very well as a supplement to your other efforts, right? As a fine tuning adjustment, not an all in, spend 100 grand a month on it kind of strategy. Hyper localized paid ads, hyper localized SEO. So for many of you, especially residential campus style treatment centers, you would find that you could reach out to a broad national audience, and those who had out of network insurance or cash pay capabilities would fly to you, right? Well, believe it or not, your local population has come home. College students are at home, right? People that would travel for treatment are now looking locally for treatment. So refine and retune your paid search ads to be local, refine and retune your SEO content to cover local geographies. Provide COVID information at a local level, and you'll find your website ranking higher. And you're going to find your Google My Business to become an invaluable tool if you haven't already. It has been performing very, very, very well. It is a free tool from Google, and it will supplement your efforts and drive admissions. That's true of all private practices as well. Google My Business is pivotal right now. Desktop conversions are back. So any method you have, any marketing you've been doing that would be accessed on a desktop computer, uh, revisit that. It's an option again. We've seen the infographics that we publish and distribute for our clients with statistics on the industry and mental health and a lot of the stats I shared earlier. Those are being digested and developed and shared and downloaded at a record level right now. So whatever that may be, whatever mixed media may be useful for you on desktop, YouTube has seen a lot of increase in desktop traffic during COVID. So let's get into the actual, specific tactical must-dos. Update your Google My Business, please. Your website, your social media. Okay, these things are critical to your success. Your review site listings, just general directory listings. Make sure the information is accurate. Make sure you've got updated COVID protocols on all of these platforms. People are Googling addiction treatment near me. People are Googling drug rehab near me. You need your website to show up. It needs to be COVID relevant and needs to have up-to-date localized content. Continually create new content. So now more than ever, with some fine tuning in Google's own algorithm, they are prioritizing healthcare information and news, but they're only prioritizing the new stuff. They're not discluding any of the old stuff, but if you frequently are adding new information about COVID and the societal impacts on mental health, you will find your site ranking pretty darn well. Current topics, advice, frequently asked questions, diagnosis and assessment tools, right? How to know if you're in a toxic relationship. That kind of blog content has actually been getting a lot of traffic. That self-assessment, do I have a cold or the flu or COVID? Those kind of searches are at a very high level right now. Video has been such an ideal format during this time. It is transparent, it's informative, and it's easy to digest, right? So if you see a YouTube ad of a doctor in a mask saying why their treatment center is safe and the new methods they've deployed to keep their patients safe, it's believable, it's trustworthy content. So link this content from your social media accounts, from your video accounts like YouTube, from your blogs, to the corresponding service page. I've seen a lot of people do what I'm saying. They've been creating new blogs, writing more articles, making more stuff, but they're not then linking that content over to your actual service page, right? So if I'm reading an article, how do I know if my loved one is struggling with a heroin addiction? And they go to an article you wrote about that, and it doesn't link over to your page for your heroin rehab program, you're missing out on opportunities. What you need to let them know is this is a real condition. Please read our content. Oh, and by the way, it's treatable, and we have a program just for that. You might want to look into it. So don't miss the opportunity for a call to action or to actually advertise your programs and levels of care. The switch to virtual. Let's talk about comfort levels, right? So you're all at a virtual conference right now, watching my virtual presentation with a virtual background. And this is not the first time you've experienced this since COVID began. So while this was once an unfamiliar channel and Zoom meetings and Google Hangouts and WebEx and all that stuff, while that was all unfamiliar or uncomfortable for the bulk of our population, it is now routine for all ages, all professions, everybody. So virtual meetings with former patients are more highly attended than in-person meetings. Your alumni events, we've seen 700 to 800% increases in attendance of alumni events through virtual apps and platforms. Virtual appointments and meetings will outlast coronavirus. So people want to set their own meetings and appointments through some kind of a tool. And again, this is all medicine. To see your dentist, you'll be setting a meeting through some kind of a calendar setting app or something. So realize that the consumer is now used to this and comfortable with this. And by the end of this calendar year, every American statistically will have engaged with telehealth at least once. Make your alumni marketing a priority now more than ever. Okay. So the better the relationship that former patients have with your program, the more likely that three things happen. It's not just them that you're communicating with. They understand that you have their back, and this is a difficult time. And if you are the friend who has their back in a difficult time, they will have your back. They will evangelize that you care. They're less likely to relapse. So again, you may be saving a life. This is someone you treated. This is someone in your medical care long-term. And so the isolation and depression, these indicators, these triggers, you've got to get involved. Okay. Again, this is the moral obligation part that I was talking about earlier, but they are more likely to act as reliable referral sources. So in your alumni marketing, right, as you reach out and sincerely work with them as individuals to keep them well, give them resources, find them virtual resources to engage with, and have your own social events. Even very important right now, job placement and life skills training. So to have a Zoom meeting where you focus on resume writing, it's really important right now. We've got, tens of millions of unemployed Americans. It's important. So think about that. Think about the opportunity to present new information, new content, um, and engage with your alumni graciously. Your social media. Okay, so this is interesting, and I've got my own opinions on social media in general. I do not believe that it is a direct admissions source. I find it to be a very indirect admissions source. But here's what we've seen in terms of social media engagement. So this is really moving forward. It's from now through the post-pandemic next normal. Make your social media presence more meaningful. Make it more profound right now. Talk about deep issues. Describe how you care about your patients. Talk about the family interactions and the types of toxic relationships that people might be experiencing right now throughout their addiction. It is welcome right now, as opposed to intrusive or advertising, broadcast style communication. It's what people are looking for. They need this information. They need to be able to self-assess because there's no one else to do it. They're isolated. So your social media can become a channel where this relevant real-time discussion, a dialogue, can be taking place, and you can involve current patients and prospective patients, right? You can have video sessions, you can have group meetings. Think about all the different ways you can apply technology through your social media. Your alumni community needs to be built out much more formally than anything you may have now. Even if you think you've got that on lockdown, it's an opportunity to add more value to your alumni. And families will thank you for that, credit you for that, and become evangelists as well. So asking for reviews, if you've been responsible and asking how your alumni are doing and demonstrating that courteous respect, it is an opportunity for them to give respect back and leave good reviews, and say, hey, I was really glad to receive a phone call. I wasn't doing so great. And I got a call from the alumni director of, ABC Treatment Center. Glad to see they care. Glad they care if I'm doing well, right? It can be that simple. So beyond that, the feedback loop, the opportunity to get feedback, people are stuck at their computers. They're bored. There's not even enough content to digest. So they're going to virtual conferences and listening to guys like me because there's nothing better to do, right? You can ask for feedback right now. Hey, what do you think of our social media? Hey, what was your experience like in our program, and how can we clearly address that issue head on through videos, right? It's been a really interesting experience to see the blunt, direct feedback that alumni communities have been giving to treatment operators over the last few months. It's been unique. Building on your existing assets, okay? So myaddictiontreatmentwebsite.com. You need to, I want to sound judgmental here. Many of you have failed to address these primary, website best practices. So I'm going to address it as an opportunity during COVID, but it's really a standing opportunity. It's not a matter of doing something new. It's doing a better job with something you already have, and that will lead to growth for you. So a website design overhaul, and I mean this conceptually, but better user experience. You're getting a ton of engagement right now, and the data from your Google Analytics and Search Console, it's showing you exactly what to do. It's showing you exactly what pages are being interacted with. Use that data. It's super accurate. It's super useful right now. And realize that, again, the most volume of searches is going to be coming from mobile devices, but the conversion rate growth is coming from desktop devices. So you need really strong mobile experience, and you need really strong design, a strong aesthetic that is modern, that is friendly, that is engaging and enticing during COVID. You need safety videos. I've seen a lot of written text safety protocols, or a little pop-up on your website, or a text bar up top. It is so much more impactful to have an executive, a clinical director, on video wearing a mask or 5 masks or whatever the case may be, and a brief video tour, right? Where have you added plexiglass? Where have you made the facility safe? What does a quarantine room look like just in case, right? Um, how are these things set up? So you will alleviate fear and demonstrate respect to your potential patients by making this video format content. It's also pretty easy to produce right now. Okay. You don't need to hire video crews. This is iPhone level content, and people are okay with that. They understand the limitations on your media production resources right now. Internal staff. I'm going to address this because I've seen everyone fail to do this. You do need to be marketing to your staff right now. The ones that are coming to work are diligent frontline workers, and their loyalty is not to be questioned, and their safety is to be made a priority. You need to tell them how you're doing that, or you're going to risk, whether it's now or right after lockdowns start to end, you're going to risk them leaving. Okay. So just by showing up, your team is giving you an added level of dedication. You need to show up too and tell them how much you appreciate that. If your team is working remote, you need to tell them what you're doing to make it an option to come back to the workplace again and keep things safe. So I don't mean that again as public service announcement. I mean that as a person-to-person issue of respect. But that's a marketing audience. Your staff are your best salespeople. They're the evangelists you've had the whole time. So don't ignore them, and don't avoid their concerns. Okay, they're under the same societal pressures as everyone else right now, and many of them are in recovery. And you need to be doing wellness checks with them too. Show that you care. Press releases. Pretty hot topic right now, this COVID-19. Maybe you've heard of it, right? Coronavirus, some kind of a global pandemic, I guess. I don't know. I haven't read about it anywhere. Anything related to COVID-19 and another co-occurring epidemic is press worthy right now at a local level, at a national level. Try it. Try doing press releases, even just an email newsletter. You're going to find more success with it right now than you have historically, and you might get some earned media from some surprising channels. Infographics. Again, the statistics that are available right now, because everyone's online and everybody's being tracked. We've got some pretty ridiculous statistics, very marketing worthy, very communications worthy statistics like the ones I shared earlier. You could be publishing that information branded as your treatment center, get the word out, and other treatment centers are the ones digesting that information, linking to it, referencing it. And that would be good for your website ranking and general branding. The pandemic will not last forever, but change in your market and your marketing is a constant. So when I talk about the next normal and things like the Google regulation of addiction treatment providers, right? A year and 2 or 3 months of not being able to run paid ads on their platform. The best planning that you can do for these crises and these unexpected occurrences is to not only stay diversified in your marketing, not overly exposed to any one channel for admissions or patient communication, but the best planning during COVID-19 is a ready to go plan for post-pandemic, right? Anything you do right now is reactive. It simply is. But your most efficient marketing is always going to be proactive, well-planned, multi-channel marketing mix kind of a plan. So right now, you all need to be sitting down and writing exactly what you're going to do and change. Once the dust settles, once things clear, once the forest fires get under control, once the political unrest pares back, once these lockdowns and COVID get under control and vaccines come out, there's a whole lot of factors that are going to change dramatically in the next 3 to 6 months. What are you going to do to reach your audience then? Meet your patients where they are, okay? Online. They're all online. I promise you they're online. I can see them all right now. Leverage your digital marketing in new ways, please. Expand your digital marketing, but I don't mean just do more of the same things. Try new things. Use these cool digital tools and resources and channels to expand your reach and hit these additional audiences. You may not be aware of how much local demand there is for treatment and for your levels of care. The end of COVID brings new challenges, okay? It's not going to be easier or go back to the old ways. We're going to see a crazy shift that I do not see anyone talking about yet, so I'll talk about it. If we have 40 or 50 million Americans that lost their jobs or had to change jobs during this crisis, what happens with their health insurance? So tens of millions of Americans, oh, and their entire families, by the way, right? So somewhere between 1 in 10 and 1 in 3 Americans is changing health insurance coverage during this pandemic. That's going to shake up this industry in a big way. You might have local patients and you don't take their insurance anymore. You might see new opportunities. There might be more patients that have an ideal insurance to engage with your programs. So keep an eye on this because the end of COVID brings new challenges, fewer insured lives, differently insured lives, whatever that may look like. It's not going to be the same, and there will be nothing normal about it. So that wraps up my presentation for today, and hopefully you've gotten a lot of food for thought, and we can talk through some questions on chat here. You can visit with my strategy team in our booth and actually engage in video level chat and have conversations about your own efforts, your own practice, your own treatment center. But I want you all to think about that, this crazy shift that happened so suddenly. It's a sea change. It's a new opportunity for you to reach your audiences differently through different channels, create some multimedia format content that will have a good shelf life that will last you for years to come. And we'll see you at future events like this one. I'll see you at the West Coast Symposium coming up in December and the Treatment Center Investment and Valuation Retreat in December as well. And I look forward to one day getting to see you all in person again, but thanks for attending virtually today. And let's chat for a bit and visit our sponsors. Thank you.
Cool. Just wanted to give it a couple beats. There we go. And stop recording.
Okay, how do we do?